In this video, we're going to talk about treatment of the SC joint using the scapular patterns. So as we go into anterior elevation, the clavicle should move inferior and compress onto the sternum, okay, or onto the manubrium. So in order to feel for that, I want to be able to take that clavicle basically inferiorly and towards the sternum. So I need to start on this superior lateral portion of that joint. And then as I move her into anterior elevation, I need to see how does it compress. And then I can give a little spring test, and that's a hard infill there. If I want to check all 4 diagonals before I decide which one I want to treat, I take her into, set her scapula, take her into posterior depression, and then I can actually kind of keep her in that groove there. As I go into posterior depression, the clavicle should move superiorly and away from the manubrium, and so I'm on the inferomedial portion of the clavicle at the joint line, and I'm taking her into posterior depression, and I'm feeling, does that have a hard infill? And there is a little bit of a hard infill, but not as hard as moving into anterior elevation. Okay, so that's the first 2. The next 2, Kelsey, will you bring your pelvis forward just a little bit? There we go. Here. So now I'm more in this diagonal. Okay, so down and forward, up and back. My body's set up well. And now if I take her into anterior depression here, the clavicle should be moving superiorly and towards the manubrium. So I'm on the inferior lateral portion of the joint on the clavicle. And I'm feeling as she goes down and forward, spring testing into that motion. What's that infill? And there is a little bit of a hardness there as well, although I think anterior elevation is still the hardest. Now, if I go opposite of that spring, I would be coming inferior lateral here, and let's see if that matches up with posterior elevation, okay? So if I'm doing posterior elevation, I'm bringing the scapula up and back. The clavicle should be moving inferiorly, right, and should be moving away. So this is correct. Superior medial portion of the joint. As I bring her up and back, I'm feeling for the ability for that to move inferiorly and away, and that might be the second hardest infill there. So if I go to treatment, I'm still most interested in anterior elevation. So bring your pelvis back, good. So now I'm able to be in this diagonal. I take her up towards anterior elevation. It needs to move, the clavicle needs to move inferiorly and compress. Right there, okay? And now all I'm doing for my functional mobilization is hold here, don't let me move you. Basically, I'm trying to take her further up and forward, but I'm blocking that from happening with my inferior medial pressure on the clavicle at the SC joint, and let it go. Good. I actually freed up a little bit there, right there, and then hold there. And I'm just, after I do about 3 to 5 second contraction, I'll have her relax and let it go. And then I'll just kind of feel, can I go any further into that range? And I have to be honest with myself of where does that infill come on. You may not be able to move it all. Hold there. In which case you just didn't free up the infill at all. But if you can, you want to relocalize to a hard infill before you have her, and let it go, re-engage into posterior depression or just into my hand. So again, the goal is I'm trying to take her further into that range with a better infill at that SC joint. I would treat the hardest infill first and then retest all the other diagonals. Some of them that you didn't even treat may get better after treating the hardest infill, and then try to clean up any of the other diagonals that you can to see if that helps whatever functional motion you're trying to improve.